Well, more men are feeling pain in their knees in midlife. So how young is too young for a knee replacement?
Yeah, this is why we have Dr. Andrew Usoro, an orthopedic surgeon and sports medicine specialist at Kaiser Permanente, joining us now. All right, doctor, tell us, why are more men in their 40s and 50s experiencing knee problems earlier in life?
A great question. I think there's really two main reasons. One, men are just living longer and they're having a really active, more active lifestyle. The second thing is obesity. We know that obesity is slowly increasing over the course of the past several years, and obesity puts a lot of stress on the knees over time. And so I think those two reasons are the main things that we see.
So, doctor, what are some of the more common signs that the knee is becoming more serious and the issues really need to be addressed?
Yeah, absolutely. Anything that really involves limitations in daily activity and, of course, pain. If you were able to do certain things prior and now you're having a lot of difficulty with them, a lot more pain that really limits your quality of life, that's the reason to get things checked out and go see your provider.
All right, so Dr. Usoro, tell me about some of the research that's going into all of this.
Yeah, that's a great question. Arthritis is so common. And so there's been a ton of research going into how do we get this better. Some of the research involves really things like targeted injections, including stem cell therapy, and even kind of nerve ablation therapy in order to decrease the pain associated with arthritis in the long term. But this is an ongoing field because we know that, this is such a common problem, and there's lots of patients to be helped if we can kind of get this a little bit better.
Now, doctor, before you get to the stage where you have to replace them, is there some minimally invasive option that you could possibly use before surgery?
Sure, absolutely. One of the more common things are things like targeted injections, like I mentioned, things like stem cell treatment, as well as kind of more conservative options like physical therapy, really working on strengthening overall to improve pain associated with arthritis.
So I know all of the dads, uncles, brothers out there watching, they want to know, what lifestyle changes can they do to help delay or even prevent a knee replacement?
Absolutely. I mean, we all know that this may be coming when we get older. So the biggest things that I think are takeaway points are, don't let the pounds creep up on you over the years. We know that obesity is really key in terms of pain associated with arthritis, because the knee just isn't that big of a bone to kind of contain all of our mass. So anything that's extra puts a lot of stress on the knees. And then the number two takeaway point is really got to work on your strengthening. We know that if you're strong, your legs are fit, your quadriceps are strong, that really helps prevent pain associated with arthritis. So those are the two takeaway points.
And doctor, I know I have one relative who says he earned his knee replacement because he does a lot of running and marathons.
Yeah.
But he's concerned also, I remember, about what life would be after he got the replacement. Are people able to go right back to what they used to do?
I think the most important thing in terms of getting a knee replacement is doing the physical therapy and the work after surgery. That is so important. If you don't do that work, then you, unfortunately, you're just not going to get back to the level that you want to. But certainly, I know patients who have knee replacements who still run marathons. They go hiking, they go travel. So absolutely possible to get the life that you want with a knee replacement, but you have to do the work.
All right, where can we get more information?
You can find more information with us at Kaiser Permanente at kp.org.
Well, Dr. Andrew Usoro, thank you so much. We appreciate your insight. Hopefully we don't need you too soon, but we thank you. Thank you for telling us where to find that information. Thank you, doctor.
Thanks so much for having me.